Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 2nd of December. The numbers first. Today we're showing 122 COVID positive patients on our hospital sites. That is patients who are within 14 days of their first positive COVID swab. This time last week the number I reported was 138. So we are seeing a gentle but not dramatic decline in the numbers. Of those 122, 94 are on the Blackpool Victoria site in general wards, 6 are in intensive care and 22 are at Clifton. I'm sorry to say that we're reporting an extra 51 deaths logged through the last week since we last spoke. And again, to clarify, these are deaths where patients have had a positive COVID swab within the last 28 days. So some will be because of COVID, some will be with COVID, and that detail comes out over a period of time. But it's clearly a large and worrying number, and sad for everybody involved, and condolences go out to all the families who are connected to that. Very difficult for our staff, I think, who are experiencing this high level of illness within the hospital site. If we look at the community figures, we're seeing again a gradual decrease in community figures. So again, these are from the BBC website, of course. This time last week, Blackpool 209 per 100,000, today 169. Fylde 239 a week ago, today 145. Wyre 145 last week, today 119. But Dr. Rajpura, who's the Director of Public Health, is very clear that the area still has a worryingly high level of our citizens who are over the age of 60 who are testing positive. So within that data, we have a concerningly high number. And that, of course, that age group, as you all know, is the high-risk group for developing symptoms from COVID. So it's a further reminder, if we need one, that we have to stay so careful about reducing our own risk and risk to others through all the ways that everybody knows. Just want to say something about outpatients and other access to the hospital. Clearly our visiting is still very restricted, but we are able to offer video interaction between families and patients on the ward. And if you are a family member of somebody who is in hospital at the moment, if you contact the ward, they may very well be able to fix up a video consultation using an iPad type of arrangement. So we would really be pleased to arrange that for you. It's very much valued by patients and of course by families as well. And the same applies to outpatient appointments. We are offering a lot of video appointments where the clinician interacts with the patient over a video link. So if that's being offered to you, if you're waiting for an outpatient appointment and that's being offered, and you have an iPad or a smartphone or the facility to do that, I'd really urge you to try it, because that technology has really improved. The clinician has your records in front of them, they can interact fully. Of course they can't examine a patient that way, but they can make a lot of judgments about what might help to move things forward, and of course it speeds up the interaction between patients and our clinicians. So please will you have a look at that if that's coming to you as an appointment. I think now that we're moving from full lockdown into a tiered system, we're obviously thinking about the weeks ahead. Frankly, from a hospital perspective, we are anxious about Christmas and the level of social gatherings and interactions which are going to take place, whilst understanding that people need the opportunity to enjoy the the time. So I guess my plea there is that people think about, they plan the way that these interactions are going to take place in line with national guidance. And perhaps one thing to think about is about ventilation in houses and in enclosed spaces. We do know there's good evidence that if you can keep air flowing through rooms and buildings, that reduces the risk of transmission of viruses. So I'd just perhaps ask you to have a think about that. So finally, it's another thank you to everybody for sticking with it. And maybe we can see some light at the end of the tunnel. Guidance this morning about the MHRA approving the Pfizer vaccine. We're absolutely on standby to receive that the moment it's ready. We think that with that vaccine we will begin by immunising our own staff first, and then as the other vaccines come online, that will be spreading out across the community. And of course, I'll keep you updated about that every week. So finally, again, thank you to everybody. Please stay safe and abide by the new tier regulations such as they are. Thank you.